Hello, this is Nick Walker, and I have done my presentation on stroke rehabilitation. Now, the presentation will be discussing aspects about what a stroke is and what the rehabilitation process is behind it. We'll be going into details such as history, statistics, anatomy, main population, the importance of rehab, sample 30-minute program, some risks that might be encountered during rehab, and how rehab could improve the physical wellness. So the history of the stroke. Stroke was first noted by the Greek physician Hippocrates, who is this person here on the left. So at first, a stroke was referred to as an apoplexy. Now in Greek, that term is translated as struck down by violence, and it was something that couldn't be treated at first because it was something new that they found within the brain. Now, the first victim of stroke reported experiencing being paralyzed, and he also noticed that his mental health was deteriorating. Now, centuries later, during the midst of the 17th century, Jacob Wepfer, who was listed on the right, a pharmacist based from Switzerland, discovered that victims of apoplexy who went dead were bleeding inside the brain, as well as noting that this was caused by an obstruction in one of the brain's blood vessels. So, after centuries of deeper research and examination of apoplexy victims, it was divided and dissected into two categories: stroke and cerebral vascular accident, which is also known as CVA. This occurred in 1928, and today stroke is defined as an emergency where the brain is lacking the proper amount of blood required. Some statistics on stroke. Back in 2018, it was reported that for every 6 deaths from cardiovascular disease, one was due to stroke. Um, Referring to stroke victims, it was reported that um, 610,000 of them out of 795,000 experienced a stroke for the first time, and then the other 185,000 already had a stroke in the past. 87% of all strokes are ischemic strokes, in which the blood that flows to the brain is blocked, and the adults at risk, um, it's a 1 in 3 chance that if one of the adults has a symptom of or multiple symptoms of stroke, they could be at risk for experiencing one themselves. So, as stated before, stroke occurs when the brain lacks its supply of blood that it requires to maintain normal function. So, in most cases of stroke, it's not uncommon for the middle cerebral artery to be obstructed um, at a place in the brain called the circle of Willis. The formation of the anterior circulation is the responsibility of the internal carotid arteries, while the formation of the posterior circulation is the responsibility of the vertebral or basilar arteries. They both provide circulation of blood to the brain in order to maintain normal function. The figure on the right dissects what occurs in the brain when a stroke is attacking it. There are different types of strokes that can occur. That could be either It can either be an ischemic stroke, an embolic stroke, or a hemorrhage. So an ischemic stroke is when uh, blood is being blocked from being able to travel to the brain because of plaque that is attached on the vessels. So another type of stroke is called an embolic stroke, where it is almost the same as an ischemic stroke. However, in this case, there are blood clots that attach themselves onto the plaque present. When bleeding occurs in the subarachnoid hemorrhage, causing a ruptured aneurysm, a hemorrhagic stroke occurs. When hemorrhage occurs because of hypertension, in part to small ruptures of vessels, the brain is experiencing an intracerebral hemorrhage. The main population who benefits the most from stroke rehabilitation are patients whose strokes are more severe compared to those of others. So benefits of stroke treatment were evaluated on regardless of the person's age, gender, nationality, ethnicity, whatever makes them unique. So research later showed that those who suffered the most severe strokes tended to benefit better from the stroke rehabilitation services compared to those who suffered from strokes that weren't as severe as the patients whose strokes were. The importance of rehab is significant since it provides victims with opportunities to regain both physical and literary skills that they may have lost due to their stroke, which resulted in brain damage. In order to retrain their minds and recreate themselves into transitioning back to an independent person, they are taught simple tasks in a new light by therapists and doctors. Depending on where in the brain the stroke was triggered, there are many different conditions that a stroke can leave the victim, including hallucinations, motion issues, paralysis, deterioration in emotional health, and difficulties with speaking and listening. It is vital for stroke victims to regain the skills that they lost as much as possible so that they can exit their rehabilitation experience as a more stable person than when they came in. For the sample 30-minute program, I provided 15 exercises to perform for a minute each for a total of 2 cycles. The first one we have here is crumbling a piece of paper. While it may not seem as physical as people think, it can actually be used to regain control of the muscles in your shoulders, as well as being able to regain control of your hands. The second exercise we have here are trunk rotations. Now, this exercise is used to regain the ability to mobilize yourself. Reaching and grasping, now this exercise is supported by a therapist or a doctor, and it is used to regain strength in the shoulders, elbows, and wrists. In addition, it can also be used as a reliable tool to regain the ability to reach down and grab items. The fourth exercise we have here are mini squats. Now, it is another exercise that's supported by either a therapist or a doctor, and the purpose of that exercise is to regain the strength in the legs to assist in relearning endurance and the ability to walk, as well as being able to stand up from sitting down. Another exercise that is supported is the hip abduction exercise. Now, the purpose of that is to regain strength in the hips and legs in order to find better control when walking. With dynamic weight lifts, patients will improve core control, balance, and shifting their weight. Another exercise that will help regain and improve balance is through the staggered stance. Calf stretching is vital for the ability to consistently mobilize your ankles, which will be necessary for walking. Getting up from a fall reteaches the patient on how to get up to sit on a chair. The sitting weight barring the elbow exercise assists in strengthening shoulder muscles as well as straightening out the elbow in order to stand up when in a lying position. Another exercise that we have here is the single leg exercise, which raises the difficulty up a level where the activity should be completed on both sides. Another exercise here is the mini lunge, and that assists in strengthening the hip, core, and leg muscles in order to help with weight shifting and balance control. Swiss ball weight shifts helps patients prepare to stand and sit. It also helps out with strengthening the spine in stiffness and rotation. Another exercise we have here is the bridge weight shifts, and they help strengthen the core and hip muscles as well as improving the balance and walking control. Quadruped weight shifts help improve weight shifting, balance, and control in order to prepare to control walking. And the shoulder horizontal range of motion is helpful with maintaining shoulder motion. Now, some risks and injuries that patients might want to watch out for during their stroke rehabilitation process is that through the anxiety of regaining their independence, they could develop clinical depression, and some of these signs include irritability, lethargy, sudden weight gain or sudden weight loss, fatigue, drastic change in eating patterns, self-loathing, social withdrawal, sleep disturbances, and even suicidal thoughts. Stroke rehabilitation can it could improve the physical wellness of patients because when you increase physical activity after a stroke, it could improve fitness and improve common post-stroke functional problems because most of these patients, when they experience a stroke for the first time, they lose a lot of their freedoms, such as walking, speech. And so, through the stroke rehabilitation process, they can regain some of those skills back, but it'll be, in the end, up to them to continue their path of improving themselves in the best way possible. And so that concludes the presentation on stroke rehabilitation. Thank you.